Hi, this is Marty with Skincare Science, and welcome back to another video. The purpose of this video is to talk directly to the client, the end user, meaning my client's client. What happened is there was discussion related to dermaplaning, microdermabrasion, chemical peels, and this particular client and acne. So when I do this video, I'm going to talk directly to my client's client, and hopefully that will really connect the information that I'm trying to give and pass that to her, so as she watches this, she'll have more of an understanding of what my client is saying to her esthetician. So as it relates to this information here, this is for something else. I don't want to delete that. So anything that I draw will be down here or maybe in this area here. Let's get started. What we're going to be looking at is 3 pictures that I received from my client of her client that were selfies taken while she was, I'm assuming, in her car, and they are center, left, and right. They're great pictures. Let's go ahead and show you those now. As you can see, a very pretty girl, nothing really other than that, but there is acne there, and what I'm going to do is I'm going to describe what I see and then go into a couple of things that I think are going on, and these are just one-off ideas, and I think the main purpose of this conversation or this video is to give the end user more in-depth knowledge about potential things that individuals in the industry, meaning myself and my client, are going to see, and then give her help with regards to how maybe she should broaden her scope as to what may be creating an increase in the acne, and or keeping her from clearer skin, if you will, because I don't think this is the only reason for her acne. I just think it's one of the culprits to why she has it. So let's go ahead and discuss that. What I'd like to do first, before I get started, is obviously introduce myself and I'm not going to say her name, but my name is Marty again, and I am the owner of Skincare Science, and it's a pleasure to be able to talk directly to you. And I appreciate, the opportunity that my client has given me. I think that it's a really cool thing, and it's very, very different within the industry. I've never seen anything like this been done, and I'm not trying to grandstand or be the first at anything, but I just think it's a really different way and a very neat way to go about helping my client and her client. There are a few things that I want to connect with you on first, okay? If I say anything like I need honest opinion or honest answers and they're difficult, it's not to tear you apart. It's not to ask questions or make statements that I don't know or that I shouldn't. But as I ask them and go through this, I think you'll see a few of them that are going to really make you think. But without honesty and direct answers, it's very difficult to help. I call it biting the hand that feeds you and licking the boots that kick you, kind of thing. So my client and myself are here to help. So I know that I'm not getting any reaction from you as far as the answers go, but with regards to these answers, if any of them make sense, those answers, please relay them back to my client or your professional esthetician, and that way the further communication can be more open and more transparent. And I think that will help everyone, help you to get where you want to be. So let's go ahead and look at the 3 pictures and see what we see. So on the first picture, the front one, as I look at the whole picture, all I see is a pretty girl. I see a little bit of acne, but that's not my first impression. It's just not. When I first looked at the picture, the first thing that I noticed was your hair, your hairline, the thickness of your hair, and then I noticed the overall view. The acne was secondary. I can tell you that what brought the acne to my attention, you know, being in the industry, was the fact that I know you're picking at it, and I cannot stress how much I would like you not to do that. It's probably the worst thing that you can do, and if you need further information on that, your esthetician can give that to you. I just want to tell you right off the bat that no matter what, when you pick it, you make your skin and you worse. There is no two ways about it. If they're small little blackheads, you know, or small little whiteheads, things like that, you know, the minor acne, those things normally can be, you know, extracted, or they can be taken care of very simply, and with no harm or no foul. But it's the ones that are deeper, and I know you know what I'm talking about. It's the ones that are deeper and not so easy, and you pick and you dig, and you really don't know what's going on. You just know that your skin's inflamed, it's hurting, then it's going to scab, and then it looks worse, and you know the routine. You know, just a side note, when I was 16, I had acne. I was on Accutane. I think it was what, 15 to 30 milligrams a day, twice a day. And I was on it for 9 months, and this goes way, way, way back. And I'll do a video on Accutane and some of those things at a later time, but I'm a proponent of it. For you, I would never prescribe Accutane. It is way too strong, way too many side effects. And basically with Accutane, if I can say this, what we're talking about is, will I prescribe Accutane for this particular client? The consequences of taking Accutane are here. And where is her self-esteem or his self-esteem? If it's here, then the consequences of Accutane are worth it to bring the level of self-esteem up. We're talking about acne grades 3 or 4 on a scale of 1 to 4. That's industry standard. Some individuals have a scale of 1 to 6. So for you, you're a 1. You think you're a 4. But if I showed you pictures of a 4, you would cry for these people. So 3 and 4s don't go outside. 1 and 2s do. When you go 2 into 3, your self-esteem is starting to drop because you're seeing the world with this. But medium grade 3s going into full grade 4s, they don't go outside. It's really, really bad. So you are a grade 1, and I know that that is not something you want to hear. You want to be treated as if you're a grade 4, but please know that that's not the case. You really don't have that bad of an acne condition. What I do see that is of concern is some of the scarring, and it's very, very light. So know that when this time for you and your acne passes, there will be opportunities and options for you to help with some of that scarring. But that is a concern. It is an issue now. So please stop picking, and if you have a 10 times mirror at home, please get rid of it. If you have easy access to the mirror, meaning it's where you are looking at your skin, try to not go to that place. Try to stay away from that place, and I don't know, find something else to do. So let's go back to the picture on the front. When I looked at it, as I mentioned, the thickness of your hair, your hairline, I noticed that immediately. It's one of the things that is an attribute of who you are. So my question is your hair part of your self-esteem? Meaning, if I pulled your hair back in a ponytail, do you feel less secure presenting yourself to the world? If you do, then that explains the hair always being down, and that will lead me into my next discussion with you. When I looked at the left-hand side or the right-hand side, and again, everyone gets confused at the selfie, is it left or right? But you can clearly see that when you swing your hair to one side, which is what I'm assuming you're doing, the hair is landing on the side with the worst acne, or the side of your face where the condition is worse. I noticed that, and at first I wasn't really putting two and two together. But then I noticed something else. When I really zoomed in on the picture, I noticed the peach fuzz that was around your ear, and I noticed that it was excessive. I know that that bothers you because it bothers every woman that I've ever encountered, and I sympathize and I understand. But I noticed that, and I thought, wow, that's a lot. And I know that you know that, and I'm not saying anything bad or negative or derogatory. It's just the way you were made. It's your genetics. So the other thing that I noticed was the pictures that I received from your professional prior to these three, it was after dermaplaning, I believe. And I noticed there was no hair on your face. And there was no hair. It was so shiny. And I'm going to go ahead and show that picture of you now. As I look at that picture, my mind started to think about a couple of things. And one thing that I noticed when I received the first picture is I zoomed in really, really close. And if you look at the left-hand side of your face, it's actually your right-hand side. But in the picture, it's the left-hand side. Zoom in really close. You actually have hair or hairs that are coming out of, like, it's not just the soft hairs. You actually have a hair coming out of a follicle where you can identify the hair, identify the follicle with the naked eye, almost like a man's beard hair. Now, what that tells me is that there's excessive hair growth, and I know that you know that, and a lot of women have it. It's just the way that it goes. But as it relates to acne, they're connected. If we go back to the picture, the selfie in the car, and look at, what was it? Well, if I'm facing this way and I look at the picture, I always get confused myself, but it's your left side, my right side in the picture. And I zoom in, I can actually see where you have those type of hairs along with the fine, fluffy, fuzzy ones, and what I think is happening is this. The reason why your acne is worse on that side is the hair on your head. When you flip it and you keep it on that side, it's rubbing against your face. And I believe that the hairs on your face, when they're rubbed by the hair, are moving, and it's creating abrasion, and it's creating, now remember, everything is happening at a micron level, very, very small. And I think what's happening is it's rubbing and causing the pores to clog, and it's not allowing everything to function as it should. Know this, acne is a result of the skin not functioning properly. It doesn't matter what part of the creation of acne, because there are many. You need the bacteria, you need the clogged pores, you need excessive oil. I mean, there are many. Obviously, you have them all because it's apparent in what we're visually seeing. But can it be created, or can it be made worse? Obviously, I believe that it can, and I believe that that is what is making it worse. If we can't see and splice your skin and answer the question of what's creating this, and all we have is the visual outside, well, what's the reason for one side versus the right side, or one side versus the other being worse? Well, when I was on the phone with your professional esthetician, I asked her, or actually I texted her and asked her, does she wear her hair on that side all the time? Your answer was yes, most of the time. So then I thought, well, her hair is really, really thick. I mean, the girl has a beautiful thick head of hair. And you can see in the picture the coarseness of the hair. So your hair isn't fine. It's very thick. It's what's like a beautiful mane of hair. And then I thought, well, why does she always wear it on that side? What's going on? from my experience with women or girls who, depending on their age, right, who wear their hair on one side, where their hair is a main part of who they are, I asked myself, if I tell her to pull her hair back, would she wear it like that all the time? Because the only way she's going to know, or we're going to know if this is a contributing factor, is if she does. So I asked that the next question, and obviously I couldn't get an answer for that. So that's basically what I'm asking you, and that's what you're going to have to tell your professional esthetician. Is that an issue? Now, she did mention to me also that you go to the gym. Here's the interesting thing about that. When you sweat, and I know you have your hair back, I know you do when you're at the gym. But if you're at the gym and you're sweating, everything is being pushed out. Well, then you could say, well, after the gym, does she shower? What does she do? That takes you down this long road of clean face and blah, 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 and all that. I think it matters, but to make an example of that, I'm not the one. You've heard where you say, okay, clean your pillow at night. Yeah, clean your pillow at night. Do you sleep on that side? Is it on the pillow? Yes. That's almost like an old wives' tale, like don't eat chocolate, don't drink Pepsi or sodas, whatever. The reason why you don't eat those is because they lower the pH of your body. It's as simple as that. Or I'm sorry, they raise the pH of your body, and your body needs to be more acidic than alkaline. Is it something you could do? Yes. If it's a variable that you want to remove, yes. Make sure they're always clean. But comparing it to the gym, I just don't see how the gym is going to matter. You look like a girl who takes care of yourself. You look like a person who cleanses right. You're definitely concerned about your skin. So all the natural, little tiny aspects of acne creation, I think you're handling right. What I'm looking for are the one-off things. This is one of them. Another thing that I would like you to maybe take a look at is, if I'm right and some of your hairs are the fine, fluffy, fuzzy ones, right, like near your ear, and you also have ones, if you look at your skin really, really close, take a look at the ones that are a little bit coarser and coming out of the hair follicles. That puts you in a little bit different typography of skin, and I'd like you to be aware of it. I think that's also an indication of potential acne consequences, But one thing is, how many times have you had dermaplaning done? And did your acne increase 2 weeks after that, or did it decrease? That's something to look at as well. And please make notes, and please really, maybe what you could do is count the acne blemishes that are visible to the skin, and then make a diary of it. And then watch your diet and watch what you're doing as far as the products you're using. And I'm almost positive that you're on Serene and you have all the products. Please stop using everything else. That is so important for you to be able to tell your esthetician, this is all I'm using, I'm not doing anything else. And try to surrender to this and don't do that, okay? It's really, really important. And I would like you to look at the grade of acne that you have on the side of your face where your hair normally is, and I want you to see the progression of acne closest to your ear. I don't know if I'm right, and I think it would be very lucky if I was 100% right. But it is one thing that I think is definitely contributing. If you can, and I know this probably isn't easy, pull your hair back and in a ponytail and wear it like that all the time. I know that it won't be easy, and there's a very difficult question. I addressed it in the beginning. Is your hair a part of your self-esteem? If it is, I know that this will be a little bit extra difficult for you, but I can promise you that if you look at the pictures and you know more about your life and yourself than I ever could, If you think that I'm onto something, if you think that my opinion has some weight to it, give your esthetician and give me the time, and please pull your hair back and follow the guidelines of your esthetician with regards to Serene products, and make a diary. And also too, there's one other thing. On your diet, just remember that any sugar or dairy, those two items, any dairy, any sugar, takes you away from your goal. It doesn't matter what nutritional science says. As far as it relates to dairy, yes, there's protein in there. Yes, it's a part of our diet, cheeses and things like that. In medical science, one of the worst things that we can put in our body is sugar. What sugar does to our body with regards to the pH, acidic versus alkaline, is it creates more of an alkaline environment. Alkaline environments do not eat anything. They create growth. Think of it this way. Warm, right? The body creates heat to kill. But warm environments, moist, warm environments, also create bacteria. Freezing cold does not. So think of freezing cold as an environment, acidic environment, and think of warm, wet moisture as acne creation. Sugar consumption creates the warm, hydrated that we don't want. Okay? Again, that's a broad bird's eye view. So it's not really the medical definition, and it's not maybe how a professional esthetician, would say that, but try to understand the ins and outs of what I'm saying, and I hope that gives you some more information, tools. And you probably already know all this, so I'm just saying it for not only you if you don't, but also for other viewers that might see this video. All right? So I hope this helps, and I'll be looking forward to hearing all of the information that you combine with your esthetician and the forward progress. And I look forward to getting the answer and seeing in reality if I hit a button or hit something that no one had thought of, and it would be really cool to be right. I assure you of that. I know you'd be much happier. So this is Marty with Skincare Science, and thank you for watching, and we'll see you in the next video.